The majority of eligible Americans have not received an updated COVID vaccine, flu shot, or RSV shot, according to the Centers for Disease Control and Prevention. As the country heads toward a busy holiday season with spikes in travel and gatherings. But experts say now is the time people should consider getting the shots. 484,329. That's how many COVID-related hospitalizations were reported in the week ending on November 11, according to the CDC. This number is up 8.6% from recent weeks. There were 7,279 reported cases of RSV, up 1,400 from the previous week, and there was a 4% increase in positive flu cases. Over 50% of adults who were previously vaccinated and don't have the new COVID vaccine cite lack of concern about COVID as the reason they haven't gotten the updated vaccine, according to KFF data. Over 35% say they've been too busy and 32% say they're waiting to get vaccinated at a later date. Since the COVID public health emergency was lifted in May, safety precautions have become lenient. Only 12% of the population is masking, and this Thanksgiving travel season is predicted to be the busiest in 18 years. People aren't scared of this virus anymore. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia, told Vox. This year's flu vaccine rates are on track with last year's flu season, though slightly behind, according to CDC data. The flu vaccine has been around since the early 1900s, so people are likely used to getting them every year. On the other hand, COVID vaccines were first available in 2020, and were met with hesitation, and the most current vaccines were approved earlier this year. Although the first RSV vaccines and antibody shots for older adults, pregnant people and infants were approved this year, there have been several drawbacks. Due to the way they're covered under Medicare, individuals may have to pay upwards of $300 out of pocket for the shots. There's also a shortage of some infant antibody shots, causing doctors to prioritize high-risk infants at the request of the CDC. However, the CDC and the Food and Drug Administration announced plans on Thursday to expedite 77,000 doses of the shot. There has been an uptick in childhood vaccine exemptions for measles, polio, tetanus and other diseases that some experts believe is connected to skepticism of the new COVID vaccines. 40 states saw a rise in exemptions granted to school-aged children, and 3% of kids entering kindergarten had one for the 2022-2023, which is the highest rate ever reported in the U.S. Idaho was the state with the highest reported exemption rate, where 12.1% of kindergarten students had been granted an exemption, followed by Oregon with 8.2% and Utah at 8.1%. The CDC say 90% of all exemptions were for non-medical reasons, including religious and philosophical ones, though they didn't specify further.